Can vasodilation be measured during a migraine episode? Imagine trying to catch a fleeting moment in a busy city street. That's similar to measuring vasodilation during a migraine attack. It's a tricky process, but definitely possible with the right tools. Vasodilation means the widening of blood vessels, which can be checked by looking at blood flow or vessel size changes. During a migraine, scientists think blood vessels might widen or narrow at different times, but it's not always clear when or how much. To measure vasodilation, researchers often use special techniques. One way is to look at blood flow in the arm using a method called venous occlusion plethysmography. This involves temporarily blocking blood flow and then measuring how much blood rushes back in, which shows how much the vessels can widen. Ultrasound is another tool that can directly measure vessel diameter, especially in the arteries of the head. These methods are non-invasive and can give real-time information. However, measuring blood vessel changes directly in the brain during a migraine is more complicated. Imaging techniques like magnetic resonance imaging or computed tomography scans can sometimes show vessel size changes, but they are usually done after the migraine has started or after giving a trigger that causes vasodilation. It's hard to catch the vessels in the act during the peak of pain because of the need for quick, precise measurements. Some studies have looked at blood flow responses to substances that cause blood vessels to widen, like sodium nitroprusside or substance P. These are infused into arteries to see how much the vessels can dilate. Interestingly, during migraine-free periods, these responses are often similar between people with migraines and those without. This suggests that systemic blood vessel function might not be different in migraine sufferers when they are not having an attack. In the case of cranial or brain blood vessels, evidence suggests vasodilation might happen before or early in a migraine attack. This could trigger the headache, but at the peak, blood vessels might actually constrict or stay stable. The role of vasoactive peptides like calcitonin gene-related peptide is important here. This peptide causes blood vessels to widen and is linked to migraine pain. Blocking its action can reduce vasodilation and relieving symptoms, which shows how vascular changes are involved. Vascular factors like endothelin-1, which causes blood vessels to constrict, also fluctuate during migraines. So both dilation and constriction are part of the process, possibly at different times. Measuring vasodilation during a migraine can help us understand how blood vessels contribute to the pain and guide treatment options. For example, drugs that block vasodilation, like calcitonin gene-related peptide receptor antagonists, are effective in stopping migraines. In research or clinical settings, non-invasive tools like ultrasound or blood flow monitors could be used to track vascular changes during attacks. Knowing when vasodilation occurs during different phases of a migraine, whether in the prodrome, aura, or headache phase, can help time treatments better. Overall, vasodilation can be measured during a migraine, but it depends on the timing, the method used, and the individual. It's part of a complex puzzle involving nerves, blood vessels, and chemicals. While blood vessel widening plays a role, it's not the only factor causing pain. Understanding these vascular changes helps us develop better treatments and manage migraines more effectively.